For this video, we're looking at the pharmacist manual and going to talk about the closed system of controlled substance distribution. Hopefully it's just one part, but this is going to make up the bulk of your test. So I'm going to go fast. I'm just going to go over, what basically you need to know. So the closed system goes from manufacturing, transport, wholesale, community pharmacy, patient returned, destroyed. Must be able to prove where the control is at every step to the DEA. So the Federal Comprehensive Drug Abuse Prevention and Control Act, which is also known as the Controlled Substance Act, CSA. There's Title I, which established rehab programs for substance use disorder, SUD, and Title II, which is registration and distribution of controlled substances. So Title II is where most of our questions are going to come from. And classification of controlled substance is done by the Attorney General of the U.S. There's Title III, which is regulation of importation and exportation of controlled substances. And you should know that state regulations cannot be less strict than federal regulations. And I guess you kind of would have ignored marijuana at the moment. But so for your classification of controlled substances, the C in C2, C1, C3 stands for Controlled Substance Act. So your C1s and C2s have the highest potential for abuse, but C1s have no medical use. And then we go down the list. Well, so C2 is your stimulants, opioids, codeine, just plain codeine for pain, and cocaine is also C2. C3 have less abuse risk, and as we go down, that's pretty much, or go up, that's pretty much how it works. C3s are your anabolic steroids, your codeine-containing products, as long as there is more than 200 milligrams per 100 milliliters, or 200 milligrams per 100 grams. So that's definitely going to be a question. Your state could be a little different. It's C5 if it's below 200 milligrams per 100 milliliter or 200 milligrams per 100 grams. But also C3 are your testosterone-containing products and some of your buprenorphine-containing products, or all of them. So C4, this includes your benzos, like Xanax, Zolapram, anything, all the ones that end in pram, basically, or Olam, are your C4s. Hypnotics for insomnia, Lunesta, Ambien, Tramadol products, phentermine, and phenobarbital is a C4. So pentobarbital is a C2, and so is Seco and amobarbital. Butabarbital is a C3. And yeah, phenobarbital is C4. So moving on, your C5s. Now some states will allow you to sell these over the counter, but if you're in Alabama, we are not one of them. But C5s are Lyrica, Lomotil, your codeine-containing cough syrups, like I just mentioned. And so let's go on the labeling. Manufacturing, label, and packaging must reflect the clear identification of appropriate schedule of the controlled substance. So for DEA registration, Form 224 is basically what a pharmacy uses to register. Manufacturers and distributors would use 225. Separate registration is required for each place of business or professional practice where controls are manufactured, distributed, or dispensed. And something that is exempt for a prescriber, they may write prescriptions from more than one location without separate registration. So definitely read your questions. And so of note is that Walgreens would have a different registration for each store. Some activities that require DEA registration include the manufacturing, which is packaging, repackaging, labeling, relabeling. It does not include activities for administering, dispensing, the normal course of practice for manufacturing. So for distribution, you have to register for to do these with any controls, and to dispense, you obviously have to register. There are exemptions to possess controls without registration. So in this case, you're exempt if you're doing this in a normal course of business. If your job involves this and you are working. If a practitioner authorized by the state in which they are practicing, you must be practicing within the scope of professional practice and your employment. Some other exemptions include public health services and the Bureau of Prisons doing their normal course of duties. So the Controlled Substance Act's definition of practitioner. So physician, dentist, veterinarian, scientific investigator, pharmacy for dispensing purposes only, hospital or other person licensed, registered, or otherwise permitted by the U.S. or the state to practice to distribute, dispense, conduct research with a controlled substance in the course of professional practice. So practitioner may distribute without registration, so they can be a distributor to other practitioners for the purpose of general dispensing, provided that the other practitioner is registered, they maintain proper records, use DEA Form 222 if they need to, and for C1 or C2s. And total controls distributed is not more than 5% of total distributed within 1 year. So a practitioner may return controls without being registered as a distributor. So DEA forms, we'll talk about real quick, must maintain for at least 2 years. You have 222, which is ordering and returning C1 and C2s. 224, Application Registering and Controlled Substance Act. 225, register as a manufacturer, distributor, and narcotic treatment programs. 41, which includes after or destruction, and includes after spillage or damage for your controlled substance. 106 is for significant loss. It has to be significant quality or amount of control lost or stolen. So there are wholesale SLCP registers. They need DA Form 510. And you do renew your DA Form 224. You renew your 224 application every 3 years. And it's done with 224A. And your chains use 224B. That's probably not going to be a question, but hey. Some notes, security-wise, C1s must be stored in securely locked, substantially constructed cabinets. C2s and 5s may be stored in the stock of non-controlled drugs or in the same fashion as a C1. Euthorpine, HCI, and diprenorphine must be in a safe, steel cabinet or the equivalent of a Class 5 security container. So theft or significant loss, be sure to tell DEA within 1 day. And you tell them directly and send Form 106. Unless there's no theft, you have to tell the DEA it didn't happen. There was no theft. So inspections under the Controlled Substance Act, the DEA has the authority to enter inspect any phase where controlled substances records are kept and the persons are registered. Before the inspection, the DEA must state purpose of the inspection, whether it be routine or violation. They have to present credentials and present written notice of inspection. Voluntary consent is required, so a written statement of informed consent to search from the owner or pharmacy in charge. It cannot be coerced. Consent can be withdrawn at any time. So you do have the right to refuse until an administrative inspection warrant, AIW, is obtained. The warrant is used when consent is refused. Consent is not required for the warrant for them to search, of course. Some exceptions to the warrant: the initial inspection for license purpose. So these are basically reasons the DA doesn't need a warrant to search. The initial inspection for your license, administrative subpoena, informed consent of owner, imminent danger to public, emergency, if an arrest has been made, inspection of areas open to public or in plain view. And your opioid treatment programs, they have to recertify, recredit every 3 years. Approved drugs for opioid addiction include your methadone. Pharmacies dispensing methadone for opioid treatment programs must be approved by authorities. Any licensed pharmacist may dispense methadone for pain. Some other drugs for opioid addiction are your levo-alpha acylmethadol, LAAM, buprenorphine sublingual, Subutex, buprenorphine naloxone, SL tabs, and sublingual films. Buccal films, they all have different names: Kespa, Zufsol, Punavil. All three is the Suboxone. So your Drug Addiction Treatment Act data was in the 2000. Allows for treatment outside of the OPT, the opioid treatment program. Qualifying physicians have to have 8 hours of authorized training in the treatment and management of opioid dependency. Sorry. Data weight physicians, they primarily prescribe Subotex and Suboxone. Many patients get a couple at a time, so a 2-3 day supply. They have a max of 100 patients, 100 opioid dependent patients, unless additional credentials. So there's the new law, CARA, and this gave dataway physicians can now treat 275 patients after successfully treating 100 patients for at least 1 year. So it goes, dataway physicians have 30 patients for 1 year, and then they have 100 patients for 1 year, and then they can treat 275 patients for 1 year. Dataway physicians also have the X in their DEA number. It's how it starts. So your data wave physicians can treat 100, and then they can treat 275. The Combat Methamphetamine Act, so OT cell of epinephrine, pseudoephedrine, and phenylpropylone restrictions, so behind the counter, and this can vary by state, 3.6 grams per day max, and these also have to be recorded in a logbook. If it's under 60 milligrams, you don't actually have to record. But for federal, it's 9 grams in a 30-day period. For retail, is the max you can get from a pharmacy over the counter. That in Alabama, it's actually 7.5 in 30 days, and that 7.5 grams is also the 30 days for mail order. There is unit dose packaging, of course, the logbook, or it can also be electronic. The logbook can. You do need a photo ID. In Alabama, you have to be over the age of 18. So self-certification you may complete under the Act. It's annually for the SELP service providers. So mailing controlled substances, the auto container should not show any indication of the contents, and the inner container only has the name and address of pharmacy, practitioner, or other person dispensing the prescription. Alright, so the next section of the Farm Manual 910 is dispensing controlled substances, and I will talk about that in part 2 of this video.